Is your heart whispering warnings you ignore? For years, heart disease has hidden in quiet signals we often dismiss. Today, we'll learn how to listen. I'm Dr. Sam Carter, a preventive cardiologist, and this is a calm guide to recognizing the silent signs of heart disease so you can act early and protect your life. Relatable problem. Imagine Sarah, a busy parent who wakes tired, skips meals, and blames stress when she feels short of breath taking the stairs. She thought heart attacks were sudden, dramatic events on TV, but for many, the story is quieter. The problem is that subtle symptoms, nausea, fatigue, jaw pain, or unusual sweating, get labeled as stress or aging.
That delay can change everything. Why silent signs matter. Heart disease remains the leading cause of death worldwide, yet many cases begin with symptoms that are easy to overlook. Detecting them early can prevent hospital stays, disability, and death. This video will guide you through the most common quiet signals, the science behind them, and clear actions you can take today. The science in plain terms. Your heart is a muscle that needs steady blood and oxygen. When arteries slowly narrow, parts of that muscle get less oxygen. Instead of loud chest pain, the body may send soft, confusing messages, fatigue, indigestion, or sleep problems. Recognizing these messages is like hearing a low alarm before it becomes an emergency. Symptom 1. Unexplained fatigue. Feeling constantly drained despite normal sleep. That persistent tiredness can be your heart struggling to pump enough blood. It's different from tiredness after a long week. It's a steady, deep exhaustion that limits daily life. Symptom 2. Shortness of breath with little exertion. Walking up a single flight of stairs or doing light chores should not leave you gasping. If ordinary tasks feel like heavy workouts, your heart may be compensating for reduced function. Symptom 3. Chest discomfort, that is mild or intermittent. Not every dangerous episode is dramatic. Some people report pressure, squeezing, or a heaviness that comes and goes, sometimes with exercise or emotional stress. Symptom 4. Discomfort in other areas, jaw, neck, shoulder, or back. Pain can radiate in surprising ways, especially in women, older adults, and people with diabetes. Jaw or upper back discomfort can be a clue. Symptom 5. Unexplained nausea or indigestion. Persistent indigestion, belching, or a sense of fullness without an obvious cause can mimic digestive issues while actually signaling heart distress. Symptom 6. Unusual sweating or cold sweats. Breaking out in a cold sweat during light activity or at rest without feeling ill otherwise is a sign worth checking. Symptom 7. Fainting or near fainting spells. Lightheadedness or fainting suggests the brain is receiving less blood, potentially from an underlying heart problem. Symptom 8. Persistent sleep problems and snoring. Obstructive sleep apnea and fragmented sleep increase strain on the heart and can be both a cause and a symptom of heart disease. Symptom 9. Swelling in legs, ankles, or abdomen. Fluid buildup from a heart that is not pumping effectively shows up as swelling, especially after long days of standing. Symptom 10. Slow wound healing and frequent infections. Poor circulation can delay healing and reduce immune response, subtly linked to cardiovascular health. Who is at higher risk? Age, family history, high blood pressure, high cholesterol, diabetes, smoking, inactivity, and obesity raise risk. But even people without obvious risk can have silent signs. How doctors interpret these signs. Clinicians listen to symptom patterns, check vital signs, and order tests, ECG, blood tests like troponin, stress tests, and imaging such as echocardiography. These tools reveal electrical problems, muscle damage, and blood flow limitations. Simple daily checks you can do. Track how you feel after normal activities. Note if stairs, shopping, or brief walks cause disproportionate breathlessness or fatigue. Keep a symptom diary with time, activity, and intensity.
Lifestyle actions that lower risk now. Move gently but consistently. Daily walks, light strength training, and mindful stretching. Prioritize sleep, manage stress with breathing or meditation. Choose whole foods, reduce salt and processed sugars, and limit alcohol and tobacco. When to seek immediate care: sudden chest pressure, fainting, severe shortness of breath, or cold sweats warrant emergency attention. But also make appointments when symptoms are subtle yet persistent. Don't wait for a crisis. How to prepare for a medical visit. Bring your symptom diary, list your medications, note family history, and be ready to describe triggers, timing, and any associated signs like nausea or sweating.
Questions to ask. Could this be heart-related? Which tests do you recommend? What lifestyle changes would most help me now? Long-term prevention strategies, control blood pressure and cholesterol, manage diabetes, maintain a healthy weight, stay active, eat a Mediterranean-style diet, and build a support network for accountability and mental well-being. Real-life stories. Sarah, who noticed steady fatigue and shortness of breath, sought care after a week of symptoms. Tests revealed blocked coronary arteries. With medication, a procedure, and lifestyle changes, she regained energy and avoided a heart attack. Another person, Miguel, treated his loud snoring as normal until daytime sleepiness led to testing. A sleep study revealed obstructive sleep apnea, and treating it lowered his blood pressure and improved heart function. Common myths debunked. Myth: heart disease always causes crushing chest pain. Fact: many dangerous cases begin silently. Myth: young people are safe. Fact: early risk factors can appear decades before an event. When to involve your family. Tell close contacts about your symptoms and concerns. They can help notice subtle changes in your mood, activity, or daily function and encourage medical follow-up. Technology that helps. Wearable devices can track heart rate irregularities and sleep patterns, while home blood pressure monitors give useful data between visits. Use them as tools, not replacements for professional care. Emotional support and mindset. Feeling anxious about potential heart trouble is normal. Meet that fear with curiosity and action. Learning, tracking, and seeking care empowers you. Preventing panic means focusing on steps you can take today. Final checklist. Notice persistent fatigue, breathlessness with light exertion, atypical chest or jaw discomfort, unexplained sweating, fainting, poor sleep, and swelling. Keep a symptom diary, reduce risk with lifestyle changes, and see a clinician if signs persist. You can hear the whispers before they become shouts. Early attention saves lives. Thank you for listening. If you noticed anything familiar, download the checklist, share this video with someone you love, and make an appointment with your doctor. If this helped, share and check your symptoms. Talk to a doctor today.